We're fortunate to have Dr. Merrill here today with us. He's an anesthesiologist. He's actually our anesthesiologist. Dr. Merrill, kind of go through with us quickly what you kind of talk to patients about before surgery in regards to those problems.
Number one thing we talk about is safety. We're going to take great care of our patients. We'll use IV sedation during the surgery, which is one of the things it does. It's an antiemetic, which is great. For those people who want to avoid nausea and vomiting and all the other sequelae from a general surgery, we avoid that by doing a heavy sedation case. And when we add the element of regional anesthesia, where we do a PECS 2 block, PECS block, or a TAB block, TAP block. It actually aids in the analgesia without giving the narcotics and avoiding all the side effects associated with narcotics and general anesthesia. The narcotics and the inhalation gases that we use tend to cause nausea and vomiting with people, and by limiting the amount of those that we have to give people and avoiding the inhalation agents altogether, we give a very safe anesthesia. It's very effective for pain control, and the patients do very well afterwards.
So the take-home message on that is, number one, we do more sedation cases than general anesthesia, and that's putting a tube in your throat to help you breathe or assisting you to breathe. And number two, we do a lot of regional blocks or PEC blocks, which is for the breast or breast augmentation, TAP blocks, which is for tummy tucks. And there's other blocks that we do along with that. That helps you with pain control afterwards. So the main issue is to know that if you go in for cosmetic surgery, that you're going to be controlled, at least in our office, in regards to pain afterwards. In terms of after surgery, is there anything that you can tell patients, purely from an anesthesia standpoint? We're already doing things to limit the nausea and vomiting. We're doing things to help with pain and everything else like that. But from a mobilization standpoint, don't you think it's important after surgery to mobilize, to walk, to get up and going?
And that's one of the nice features about having good pain control. You're
Right.
more apt to get more back to the things that you're doing. Some people are a little over-aggressive when they're comfortable. So we have to kind of warn them of that aspect instead. But yeah, getting up, avoiding blood clots, avoiding all the, getting your bowels backed up on you, all those things by moving, it's one of the number one things to help you.
To help you recover. So that's it. So if you're having cosmetic surgery and you're going to a plastic surgeon, you got to ask about the anesthesiologist. It's super important. It's probably one of the more important parts of the surgery itself. And then if you have a history of nausea and vomiting with any kind of anesthesia, or you're concerned about pain control, talk to your anesthesiologist, someone like Dr. Merrill, who's excellent, and they can help you understand the ins and outs of that and how you're going to deal with that during surgery.